Well, things have been changing in Alabama. More clinics in that state now pausing IVF treatments after that state's Supreme Court ruled that embryos are in fact babies.
Now, to get a medical perspective on this issue and to stay away from the politics, we're just talking about the medical stuff. That's why we're bringing in 9 health expert, Dr. Pyle Coley. For people that haven't gone through IVF or for those that have had friends, you're still not as knowledgeable about the process. It's not something that just happens like in a week's time.
Absolutely not. It takes weeks to months, sometimes even years that couples struggle with this. So essentially what happens once you sort of decide you're going to get IVF is they first check out your uterus to see if it's implantable, if it's kind of healthy for a potential pregnancy. Then they'll give you medicines to stimulate your ovary to release a whole bunch of eggs. Then they harvest those eggs, and in a petri dish, they take your partner's sperm, actually fertilize the eggs, turn them into zygotes, which are single cells. That then turns into an embryo, which is multiple cells. Then they do genetic testing on that embryo to see, does it have the right number of chromosomes? Is it healthy? Is it even viable for this to turn into a child or a fetus one day? And then they put it back in, which is called the transfer. And for one successful pregnancy, sometimes you need several embryos, even sometimes up to 5 to 10 embryos per single pregnancy to actually get that live birth.
So this is months before you actually have a pregnancy of people going through this entire process. So if a hospital or a state was to suddenly stop doing ACL surgeries on knees, they could just stop it and people would have to deal with it.
Right.
This is a different process to suddenly come to a halt for many people, many families.
Completely different, because timing is everything here. It's the timing of the mom, it's the timing of the uterus. Is it ready for implantation? It's how long the embryos have been sitting on ice. In fact, there's a whole literature out there of whether you should do fresh transfers or frozen transfers, because they can have different risk profiles and different benefits and disadvantages. And then, of course, for the parents that are having a surrogate mother, for example, someone who might carry the pregnancy for them, a lot of times the legal and financial transactions have already occurred, and that implantation has to occur relatively soon.
Another question that just came to me when you're talking about this also requires that you are under a doctor's supervision fairly frequently, right?
Yes, exactly.
I mean, you would have to, I would think you'd have, because it's always risky.
Well, all the time. You essentially need to be monitored through your entire period. In fact, they have doctors that are called reproductive endocrinologists whose specialty is only to do IVF. And IVF is such a tremendous advance. Reproductive medicine has come so far that I feel like putting these types of restrictions on doctors and on patients, I can speak for the physician community. Many of my friends that I've been talking to over the last few days, they're scared. They're completely clueless as to how they should proceed, what they should and shouldn't do, and it's really put us on edge for something that I feel like has been such a tremendous advance in the last few decades.
So this is amazing science at one end, and that's worth talking about for sure, and we'll talk about what happens in Alabama. At the other end, you have, this is pure human emotion. This is as tough as it is, and that includes for caregivers and providers.
And yes, exactly, all these physicians who spent their careers training to be reproductive endocrinologists, taking care of parents who are struggling with infertility, providing them these resources, especially many of them that have walked along this journey already, and now to suddenly pull out the rug has been really jarring for patients and providers alike.
So quickly, for someone that's in the middle of the process, say in Alabama, what do they do?
Their choices are very limited because a lot of clinics are now halting everything. There's even sort of restrictions as to them being able to take their embryos out of state.
I was going to say, leaving would seem like the
right
first best option.
But transporting a frozen embryo, Tom, is not inexpensive.
No, I know, yeah.
It's not easy to do, and it could potentially have implications for the viability of that embryo as well. So I think they're trying to get some workarounds around this, but I really think in the meantime, we have to keep in mind that from a medical perspective, an embryo is not viable outside the uterus. It's not behaving like a child. You can't freeze and thaw a child like you can do for an embryo. And it may, if it has chromosomal abnormalities, never actually become a child. So to take away our ability to choose which embryos we can implant and what to do with the ones that aren't healthy has been really, really hard.
So the ruling that changed everything came from the Alabama Supreme Court. Alabama's legislature and certainly national pressure is now being brought to bear. So there may be changes. It's certainly worth following. But from a medical perspective, thanks so much for telling us much more about it and what's entailed in all of this. Good to see you. Of course, you can find much more with Dr. Coley. Just go to 9news.com/Dr. Coley. We'll be right back.